Are you looking for the ultimate guide to Baclofen? Look no further. In this comprehensive video, we will delve into the benefits, side effects, and effective uses of Baclofen. Baclofen is a medication commonly prescribed for muscle spasms and stiffness associated with conditions like multiple sclerosis or spinal cord injuries. However, its potential benefits extend beyond just relieving muscle-related issues. What is Baclofen? Baclofen is a medication that belongs to a class of drugs known as muscle relaxants. It acts on the central nervous system to relieve muscle spasms and stiffness. Baclofen is available in both oral and injectable forms, with the oral form being the most commonly prescribed. It is typically taken by mouth with or without food, usually 3 times a day. The dosage may vary depending on the individual's condition and response to treatment, and it is important to follow the prescribed dosage instructions provided by your healthcare professional. Benefits of Baclofen. The primary benefit of Baclofen is its ability to alleviate muscle spasms and stiffness. This makes it an effective treatment option for individuals with conditions such as multiple sclerosis, spinal cord injuries, or cerebral palsy. Baclofen works by binding to specific receptors in the brain and spinal cord, reducing the transmission of signals that cause muscle contractions. By doing so, it helps to relax muscles and improve mobility. In addition to its muscle-relaxing properties, Baclofen has shown promise in the treatment of other conditions as well. Research suggests that it may be beneficial for individuals struggling with alcohol addiction. Baclofen has been found to reduce cravings and withdrawal symptoms associated with alcohol dependence, making it a potentially valuable tool in the management of this disorder. Furthermore, Baclofen has been explored as a potential treatment for anxiety disorders, as it has been shown to have an anxiolytic effect in some studies. Common uses of Baclofen. Baclofen is commonly prescribed for the treatment of muscle spasticity and spasms. It is particularly effective in individuals with conditions such as multiple sclerosis, spinal cord injuries, or cerebral palsy. These conditions often result in increased muscle tone, causing stiffness and spasms that can be painful and limit mobility. Baclofen helps to relax the muscles, reducing these symptoms and improving overall functioning. Apart from its uses in managing muscle-related issues, Baclofen has garnered attention for its potential in treating alcohol addiction. Studies have shown that Baclofen can help reduce alcohol cravings and withdrawal symptoms, making it a valuable option for individuals looking to overcome their addiction. Additionally, Baclofen has been studied as a potential treatment for anxiety disorders, although more research is needed to fully understand its effectiveness in this regard. How Baclofen works in the body. Baclofen works by targeting specific receptors in the brain and spinal cord known as GABA-B receptors. GABA-B receptors are involved in regulating the activity of neurotransmitters, which are chemical messengers in the brain. By binding to these receptors, Baclofen enhances the inhibitory effects of GABA, a neurotransmitter that helps to calm excessive neuronal activity. This ultimately leads to a reduction in the transmission of signals that cause muscle contractions, resulting in muscle relaxation. The exact mechanism by which Baclofen helps with alcohol addiction and anxiety disorders is not fully understood. However, it is believed that Baclofen may modulate the release of certain neurotransmitters involved in addiction and anxiety pathways. By altering the balance of these neurotransmitters, Baclofen may help reduce cravings, ease withdrawal symptoms, and alleviate anxiety. Baclofen dosage and administration. The dosage of Baclofen can vary depending on the individual's condition and response to treatment. It is important to follow the prescribed dosage instructions provided by your healthcare professional. Typically, Baclofen is started at a low dose and gradually increased until the desired effect is achieved. This helps to minimize the risk of side effects. Baclofen is usually taken orally, with or without food. It is important to take the medication exactly as prescribed and not to exceed the recommended dosage. If you miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not double up on doses to make up for a missed one. Potential side effects of Baclofen. Like any medication, Baclofen can cause side effects. The most common side effects of Baclofen include drowsiness, dizziness, weakness, and fatigue. These side effects are usually mild and tend to improve over time. However, if they persist or worsen, it is important to notify your healthcare professional. In some cases, more serious side effects may occur. These can include confusion, hallucinations, seizures, difficulty breathing, or allergic reactions. If you experience any of these symptoms, seek immediate medical attention. It is also important to be aware of the potential for withdrawal symptoms if Baclofen is stopped abruptly. To minimize the risk of withdrawal, it is recommended to gradually reduce the dosage under the guidance of your healthcare professional. Precautions and contraindications for Baclofen use. Baclofen may not be suitable for everyone. It is important to inform your healthcare professional about any medical conditions you have, especially kidney disease, seizure disorders, or mental health conditions. Baclofen should be used with caution in individuals with a history of substance abuse or addiction, as it may interact with certain substances and increase the risk of dependence. Baclofen is generally considered safe for use during pregnancy, but it is important to discuss the potential risks and benefits with your healthcare professional. It is also not recommended to breastfeed while taking Baclofen, as it may pass into breast milk and potentially harm the baby. Baclofen for alcohol addiction treatment. One of the emerging uses of Baclofen is in the treatment of alcohol addiction. Alcohol dependence is a complex disorder that can have devastating effects on individuals and their loved ones. Baclofen has shown promise in reducing the cravings and withdrawal symptoms associated with alcohol dependence, making it a potential tool in the management of this condition. Studies have found that Baclofen can help individuals reduce their alcohol consumption and maintain abstinence. It is believed to work by targeting the brain's reward system, reducing the desire for alcohol and dampening the pleasurable effects of drinking. Baclofen may also help alleviate the anxiety and insomnia that often accompany alcohol withdrawal, making the process of quitting alcohol easier for individuals. Baclofen for muscle spasticity and spasms. Muscle spasticity and spasms can be debilitating, causing pain, stiffness, and limited mobility. Baclofen is commonly prescribed to manage these symptoms in individuals with conditions such as multiple sclerosis, spinal cord injuries, or cerebral palsy. By targeting the central nervous system, Baclofen helps to relax the muscles and reduce the frequency and severity of spasms. This can significantly improve an individual's quality of life by relieving pain, increasing mobility, and enhancing overall functioning. Baclofen is often used in combination with other therapies, such as physical therapy, to maximize its effectiveness in managing muscle-related issues. Conclusion: is Baclofen right for you? Baclofen is a medication that offers several potential benefits for individuals with muscle-related issues, alcohol addiction, and anxiety disorders. Its ability to relax muscles and alleviate spasms makes it an effective treatment option for conditions such as multiple sclerosis or spinal cord injuries. Additionally, Baclofen has shown promise in reducing alcohol cravings and withdrawal symptoms, making it a valuable tool in the management of alcohol addiction. However, it is important to consider the potential side effects and precautions associated with Baclofen use. If you are considering Baclofen as a treatment option, it is crucial to consult with your healthcare professional. They can assess your specific condition, discuss the potential risks and benefits, and determine if Baclofen is suitable for you. Remember, this video is meant to provide general information and should not replace personalized medical advice. In conclusion, Baclofen has the potential to improve the lives of individuals struggling with muscle-related issues, alcohol addiction, and anxiety disorders. By understanding its benefits, side effects, and effective uses, you can make more informed decisions about your health and explore whether Baclofen is the right option for you. Thanks for watching.